Dear friends, hello. I would like to introduce a very interesting guest today. By the way, it's almost impossible to catch that guest because he is extremely famous by his patients. The name of this guest is Dr. Matt Stefanelli, very beautiful name. He is plastic surgeon and he is anatomist. Dubai, Paris. He is a brand himself. Hello, doctor. Hello, Dr. Matt.
Hello, Olga. Hello, everybody.
Nice
Thank you
to
for
meet
your introduction. Как дела? How are you?
Very good. Thank you so much. I want to ask you my first question. I know that you work as a surgeon and you work in medicine, and most of our audience are business people and they work in different business fields. But still, since you managed to be quite famous in Dubai and you are from Paris, I want to know what is personal brand for you and how to develop it.
Thank you for your question, Olga. Well, your question is interesting, but also a little bit embarrassing for me because you mentioned I'm a plastic surgeon. So maybe for most of the audience, it means aesthetic surgeon. And it means even maybe I'm not a doctor because sometimes, you know, we forget that aesthetic doctor, aesthetic surgeon, before to do this, they are doctor. They are dealing with medicine. And you know, Olga, what happens? There is a bit of difficulties, discomfort to speak about money, about business in medicine. Why? Because it deals with disease and money, it's not very getting along, you know. So that's why it's your question for me is a bit embarrassing. On the other hand, I am in a field, aesthetic medicine, aesthetic surgery, where I have to bring this dimension, this business entrepreneur dimension. Otherwise, if I don't do it, I will miss something. I will miss customer because all of my colleagues, especially from other countries like in the US, the plastic surgeons are really having this business dimension. So I have to follow a little bit this evolution. I spent 15 or maybe more years in the hospital, not doing aesthetic surgery, but reconstructive surgery, you know, for burns, cancer, trauma, malformation, etc. And in the hospital, you are not a brand. A doctor is just belonging to the public hospital. Is just a good soldier, and there is no Instagram, Facebook, or website. It's not allowed, at least in France, when you are working for government hospital, to have anything personal. So when I move
in
out
the
from
hospital,
the hospital,
sorry, you're like a part of the big system. It's like military. You just serve your general.
Absolutely, I'm a general. And when then you move out from the hospital and you go to private clinic, and of course by definition you do more aesthetics than reconstructive, you need to bring in your activity this business and branding dimension. So what I did on my for my personal case, I tried just to share what I was doing, my work, you know, before and after picture, also publishing papers, scientific papers. So my target were both my patient but also my colleagues, because when you ask about a brand, it's not just for the patient, it's also for the colleagues. They need to identify you, what are you doing, where are you from, what are your skills, and you have to tell them. So you have to communicate. We are in a world of communication. So doctors, we have also to communicate. We cannot stay, you know, alone in our office without anything to communicate, disconnected from the world, not showing anything. People will never come to your office if they don't know you. If you don't show them what you do, who you are, where you're from, even a bit your personal life, your age. They want to know the doctor who is going to treat their body. They want to trust the doctor. So you need to inform, and information is kind of branding. So in my case, to answer your question, Olga, I just try to do this on social media, also websites, just to show people, patient and colleagues, who I am and what I do, where I do it, also Paris and Dubai. So sometimes I'm informing my patient that I will be in Paris, sometimes in Dubai. So it's not nothing more than communication. But it's true that with doctors, with medicine, this is not something very natural. So we have to make the job of a doctor evolve. My parents were doctor. When they see me on Instagram, they don't recognize their job. My father, for example, was dermatologist, so he was close to my specialty, you know, dermatology, plastic surgery, but he didn't do any communication, website, Instagram, so Facebook, whatever. There was no branding. It was just, you know, on the, you know, the book with all the numbers for the office doctors, and people were looking for the number, calling the secretary, and that's it. So there was, at this generation, there was no need of branding. But now, completely different story. Yes, doctors, in particular in private, not in public, and in particular in aesthetics, a little bit less in reconstructive, we need to brand ourselves.
You answered it amazingly good and in full details. But Dr. Matt, tell me please, you have a very good success in Instagram. You have so many followers. If I remember correctly, it's around 30,000.
Not so much. You make a little mistake, my dear. 17,000.
17,000. That means you will have 30,000 very soon, because I never make mistakes, you know, Matt. So that means that. So tell me, please, how it's happened. It's just you working on that many years, or you're looking for some interesting pictures, or you make arrangement with your patients that they agree to show, because it's quite a big number and it's a big work to reach that amount. How did you do that?
Yeah, so you mentioned Instagram. This is interesting that you asked that, because this is for the doctors at least, and I think also many other jobs. Probably the most adapted social network for business, for professional network. Facebook, it's more for personal life. I think there are other social network like I don't know, TikTok or whatever. But for job, for professional, I think Instagram is the one. That's why since maybe 2 years, I decided to choose Instagram as my you know, exposure, and Facebook is very low on my side for me. Of course, it comes first. So as everybody, 12 years ago, I start with Facebook, but then I reached the 5,000 followers limit, and it's basically now very, very slow, very low activity. And yes, Instagram is my main social network, and I reached 17,000 right now, but I was before COVID, 6 months ago, I was only 10,000, and maybe at Christmas I was 8,000. So I really increased my activity on Instagram in the last year. And what is the goal? Yes, to show some before and after picture of my patient, but it's a very sensitive topic, because you know, both in Paris, in France, and in Dubai, in UAE, we have some limitation. We cannot do everything as we want. We are on one hand considered as businessmen because we pay VAT, and VAT is something very you know, business related. But on the other hand, we cannot do so much publicity, because as we said, for the branding, publicity is not very well you know, fitting with medicine. Same story. So we are always at the limit between information and in publicity. So sometimes doctors, my colleagues, we can go a little bit beyond what is allowed without the intention to make something wrong, but just because the regulation for the doctors is very strict. So before and after picture. Also my second activity, which is also education. As you mentioned, I am an anatomist. I am trainer of anatomy with an anatomy school called High Class Anatomy, dedicated to the anatomy learning and education for plastic surgery and aesthetic medicine. And that's why I came first 4 years ago in Dubai for education. Now I'm practicing here. So I'm showing also this education activity, and also a little bit my personal life. I have a beautiful daughter. She's 17 years old. So my Instagram basically is a mixture of everything: my clinical activity, my educational activity, and my personal life. And I don't know, one day I will do personal, one day I will do clinical, one day I will do educational. So every 3 days I mix, and I think this is my way. Some people, they separate completely professional and personal life. In my case, also because I don't want to manage too many accounts, I just put everything on behalf of my professional, which is a little bit also personal account, which is basically my single account, Dr. Matt Stefanelli, and that's it. So this is how I manage my exposure through social media. Olga.
Okay, this is great, and that's why you are that busy, because I can imagine all day you are with these patients who are running after you, and then you have to put one day your personal life, then your clinic, then education. That's why you can never catch Dr. Matt Stefanelli, because he's either in the clinic or with his Instagram. Now we know the secrets. My next question is about how different is personal and corporate brand. Let's say, how's different your brand as Dr. Matt Stefanelli and the clinic that you're working for? Is it completely different things, or they are somehow connected?
Okay, nice, interesting question. So let me explain you exactly what are my activities both in Paris and Dubai. You have two types of doctors. You have the doctors that are very stable. They are always at the same place. They will stay there all their career, 30, 40 years. It was the case of my parents. They are from Bordeaux in France, and my father dermatologist, my mother pediatrician, and basically they had only one practice their entire life. They stay at the same place in Bordeaux, same office for 40 years. This is one format. My format is different. This is a little bit, I would say, modern, because it's including some differences. Number one, I'm not in one place. I'm in two places, Paris and Dubai. So it's quite international. Number two, I'm not doing only practice. I'm doing also education. So with these two differences, it makes my life much more busy, but also much more unstable, because I'm traveling both Paris and Dubai for my clinical practice. I'm also traveling in normal time out of COVID for my education. So I'm moving much more. And this is why it's a bit different than my parents. You know, my parents, they stay same place. For me, always moving. Except for COVID, for the first time of my life, I stay 6 months in a row in the same place in Dubai. I arrived here early February, and I didn't move from the country since 6 months because of COVID. So to come back to your question, what was your question, by the way? I don't remember. I lost.
Dr. Matt, don't worry. Dr. Matt, don't worry. You already almost answered my question, so it's not that important what was my question, since you already answered it.
No, corporate versus personal, no?
Yeah, absolutely. But you almost answered it, yeah.
No, but to be more precise, to complete the answer, so corporate means company, and personal means my person. So actually, my activities, the venue where I'm working, they are not mine. They are belonging to other people. In Dubai, to another plastic surgeon, from Lebanon, in Paris to businessmen. Why? Because it will be difficult for me to have my own clinic in two different places. So to give me more flexibility, I decided to partner two clinics, one in Dubai and one in Paris. And this way, it gives me flexibility. I don't need to invest so much in this place. On the other hand, I need to work, as you can imagine, on income sharing. This is a format. If one day I want to stop traveling, I decided to go only in one place, I will probably build up my own clinic. But this it will be also the end of this travels everywhere in the world, of this double activity, because when you are investing in a place, you need to stay there. You need to be stable, to fix, to invest your time and your money in this single place. So far, this is my choice. I want to be able to have this bipolar activity for between Paris and Dubai, and between education and clinics.
So if to sum up what you're saying, I think the strategy to develop your brand is two places, Dubai and Paris. And because two of these places are very fashion, it's like a good benefit, because you're not in Uganda, you're not in some very isolated place, which is quite famous and good. And the second thing, because you match between education and aesthetic and anatomic. This is the strategy for your brand as Dr. Matt. Yeah.
Yeah, exactly. This is my strategy. I mean, this is also my passion. This is just not just a strategy. I'm not, it was not so difficult to decide, because basically I try to do what I want, what I love, what I'm passionate for. So I like to operate surgery. So of course I will never stop that. I like to educate also. I like to be an educator, a trainer. I like to share the knowledge I learned from my mentors, my chief before. So, and I like to travel. So I like it was natural. I'm not, forcing myself to do education or to travel, because if I do it only because I love it. So my strategy is basically following my passion. And I think when you do things with passion, it works.
Goes without saying. Tell me, please, what are the mistakes that experts or businessmen can do when they develop their brand? Some people saying, Olga, we're trying, we develop, we invest in our brand, but nothing is going on. We spend so much time in Instagram, in this and this, but it's not working. In your case, it's different. It's working very well. Can you recommend what can be mistakes and how not to make that mistakes?
Yes, number one, you have to recognize your strengths. So you have to be very clear on who you are, what is your expertise, what you are good for, and you have to recognize your weakness. So strengths and weakness, number one, and of course you have to. It makes sense to expose, to develop your strengths, and then to try to let on the side your weakness. I give you a very precise example from my practice. I decided to stop rhinoplasty, nose job, surgical, not completely, but to reduce significantly, because I was just realizing that I was probably not good enough to provide in a very consistent way more than 95% of satisfaction to my patient. I had a low ratio, 50, 60%. Of course, we know that rhinoplasty is very difficult. It's the lowest rate of satisfaction in a whole plastic surgery. And basically, you need to do only that if you want to be good in the surgical nose job. So, except simple nose job, I decided not to do any more complex nose job. On the other hand, I decided to develop two specific surgery, the Botox surgery and the genital surgery, because I acquire with time a good expertise in this field, and also because it's a little bit less attractive for my colleagues. So I developed two strengths. I let on the side one weakness. So now my brand is more focused. People can identify me better on my strengths. So I try to communicate to develop this, and also for not only the buttock and the genital, but also the face and the breast, of course. But you have to really make people understand what you are at. And especially in big cities like Paris and Dubai, where there are a lot of plastic surgeons, you can't do everything good. You have like, you know, in orthopedic surgery, there is the specialist for the shoulder, there is a specialist for the spine, there is a specialist for the knee. You cannot be the best in everything. So you need to decide one, two field where you are really very good, and people, they will travel for you. And in my case, the two things I decided: Botox surgery, covering everything from A to Z, not only the fat grafting, you know, the famous BBL, Brazilian butt lift, but also buttock implant. I developed a specific technique called French butt reshaping, FBR, that is opposed with the BBL because it's a mixture of fat and implants. I can also sometimes remove ribs when I want to snatch a little bit more the waist. I can use filler, I can use many threads. So when you are an expert in a field, you do everything from A to Z. You have more and more patients coming from all around the world for that. So your expertise increase. And this is exactly what happens with me for the buttock surgery. I'm so far the single plastic surgeon in the country, in the UAE, to perform buttock implant. So all patients thinking for buttock implant are coming to me, even sent sometimes by my colleagues, because my colleagues for some reason don't do it. And this is how I reach this high number, good activity in buttock surgery, and also for the genital. But of course, I do also the rest. I do breast, I do face, I do hand, but I don't promote. So to conclude on this specific question, my strategy is to focus on specific field where I'm considered as an expert, and both my colleagues and my patient will identify me as an expert, and they will come to me.
Great. Maybe because of teaching now helping you to speak very good, and we can see that you can even teach the strategies of brands, since you reached very good success in that. I would like to ask you, if you allow a little bit personal question. I'm not that big specialist of Botox, believe it or not, but till this age I didn't do anything. But I don't see much of Botox in yourself, Dr. Matt. And normally doctors who are doing Botox, they're very much obsessed with being completely Botox type. What is that? What's the meaning of that?
Good question. I confirm that I am 100% Botox free, and I'm going to prove it. So I'm going to do the same maneuver that I'm asking to my patients. So raise the eyebrow, now be very upset, big smile, and sniff. So you see, if I do it everywhere, I can show you that
everything is very emotional and moving fantastically good.
Completely Botox free, a lot of wrinkles, dynamic wrinkles. So why? No, because you have two types of plastic surgeon. You have, let's say, sorry for them, the American style, you know, showing off, showing the muscle, the watch, the cars, doing publicity. This is not my style. I'm French, and in France, we are very much more low profile. We don't show off. And I have only one watch. I have no car in Dubai, only in France. I have nothing, you know, incredible. I have a very normal life, and this is why also I want to be natural on my face. Sometimes my colleagues, they look weird. A male should stay a male, and I'm hollow in my temple. I'm hollow in my cheek. I have a lot of wrinkles, but at least I'm natural, and people can maybe identify me as a genuine doctor, because if I was like this, maybe they will think, oh, this doctor is a little bit weird. Maybe we will not, they will not trust me so much. So I think natural look, natural result gives authenticity, makes you more genuine, and this is also part of my global philosophy, strategy, whatever you call it. It's not really a strategy. I just want I don't want to put the same product I put in the face of my patient. It's maybe a little bit funny, strange, but I'm going to tell you something more, Olga. as you are in a personal question, if we talk about breast implants, as a surgeon, of course, I like to put breast implant, but always natural, small. But as a man, I don't like breast implants because there is nothing better than natural breast with a small fall, good and natural palpation, etc. So yeah, I have actually a dichotomy. I have a duality, as I told you, Paris, Dubai, education, practice, but also on one side I'm a man, on the other side I'm a surgeon. So I'm always dealing with this yin and yang.
Yin yang, absolutely. You're yin and yang, black and white, night and day. So it's amazing to be like that. So, you know, you have duality. And my last question for you, Dr. Matt, tell me, please, how do you manage, you know, now it's quite tough time for everybody. There is instability in business, in traveling, and a lot of things are going on in the world which we not get used to that. But you are extremely positive, even dealing with the big amount of people, with patients. And I believe that these patients are not the easiest people to deal with, because if they come for such small things like changing their face, I mean, there is a lot of tension, definitely. But you're in extremely good mood, very, very positive, you know, like an Italian, French actor. What is the secret of that?
Well, to be honest, you have maybe the feeling that I'm 100% good, feeling good always. To be honest, this is not exactly the case. Yes, I'm very optimistic. Yes, I have a lot of energy. I am a high energy person. Yes, I'm feeling okay, but definitely this 2020 is difficult even for myself. In addition to the COVID and to the professional aspect that is the same more or less for everybody. I had also some personal problem, so some health problem also at earlier in the year. So altogether, it makes my 2020 not so fluent, and I'm struggling a little bit. But fortunately, for some reason, I have energy enough to overpass and to go beyond that. And yes, as everybody, I was, and I'm still a little bit in a survival, you know, a mood, waiting for this crisis, health crisis, to go away. Now we are a little bit recovering, but definitely we are, I think, all waiting for 2021 to start from scratch and just to let 2020 to the past. But you know, it's not because I'm smiley, happy to see you, Olga, that I'm 100% good. I have also problems to deal with, and this is life. You know, I'm 45. I'm not a little child of 7 years old where there is no problem. When you are a child, there is no problem. But when you are at our age, because I think that we are more or less in the same age.
No. I'm 29, so don't please even put me in this category, Dr. Matt. I'm very sorry. I'm agree with you on everything, but not on that.
You are not a child. You are not a child. I was just mentioning that you are not a child. You are not 7 years old anymore. So we are.
Yes.
We are more at 20 years old.
Agree.
Yes, close. So this is what I wanted to tell Olga. So conclusion, yes, I'm feeling better than a few months ago, but still I need some time to recover as everybody.
Dr. Matt, I want to thank you very much, and I want you to stay that positive and to stay that handsome and to stay, you know, to make people beautiful, because you make them beautiful and you make them beautiful with good knowledge, you know, and that is very important.
Yeah, and I want to just make a short conclusion and to complete my question. It's also my task as a doctor, but also as a father, because I have a daughter of 17 years old, to not to complain too much, to always have good energy, because if I don't do it, who is going to do it? Not my patient. They don't want, you know, a weak doctor, not confident, not in good shape. So I need always to, and also to my colleagues, to my staff, to my nurse, to my family. I need to. I am in a role, you know, of someone who wants to give energy, positive mood, to encourage everybody, because we need a leader, and I'm considering myself as a leader for my daughter. Of course, I'm the father, a leader in my clinic, because I need to manage you know, all the nurses, the staff, for the good of my patients, also in my family. So this is my role. I have enough energy to do it, so I do it easily. But it's not just that; it's a necessity when you are in my position to give good energy, optimism, and good vibes to everybody around you.
But I will tell you, you're pretending very good. So we believe you that you are on the top of the mountain, on the Olympus. So you're doing very, very well. I wish you good health, good luck, also good patience, the best of success in Dubai and in Paris. And it was a very big pleasure, Dr. Matt, to have you.
Thank you very much, Olga. Spasiba, and lovely evening in Dubai.
Merci beaucoup. Merci beaucoup. Au revoir. Merci.
Au revoir. Bye-bye.